Hello, Prof. Prof, can you hear
Good
me?
morning. Good
Yes,
morning,
Prof.
everybody.
Good morning.
Morning.
Welcome.
It's a privilege to be here once again. I'm gonna give some people, I see some people are trying to join. We're gonna give them like 1 minute. I see. Okay. Dr. Michael, do you want to be on the lookout to see if anybody is trying to join when
Yes,
I'm
I'm Adenike.
speaking?
Yeah,
All
that's
right,
my name.
thank you. Okay, it's 11 a.m. where I am. I'm sure it's different times where we are, but it's 11 a.m. where I am, and we're just gonna start. It's a privilege to be here again, everybody. Trust we're fine, trust we're refreshed. We'll be having our president, founder, and CEO, Dr. Bukola Owokole, talk to us today about something very important. I am glad he's coming at this time, and I'm sure it's going to be a time to learn for every one of us. I would want us to please remember if you have questions, you can drop them in the chat box when the speaker speaks so that would address them when she's done. Um, so I'm going to hand it over to Dr. Michael. Dr. Michael, over to you.
All right, thank you so much. Good morning. Here it's the evening. Here in Nigeria, it's about 6 p.m. here. And I'd like to again welcome each and every one of us, just as Professor Akinlade has done. I know that we are joining in from different parts of the world. We have those who are joining in the afternoon, those who are joining in the morning, like Professor Akinlade, and those who are joining in the evening, like I am, and those joining at night. Not to say that the sacrifices you are putting in to get knowledge, to get value tonight will not be a waste, because we know who is going to be speaking to us today. One who is an embodiment of value. I like to call her the capacity woman, the capacity lady, because she knows her onion. She has gone far and wide, above and beyond, to gather as much skills, as much capacity. And tonight, she'll be giving us just part of it. And trust me, the part that she'll just be giving us tonight is one that would change most of our lives forever, especially some of us who will be preparing to, get into the medical field deeply and are preparing for some interviews. So tonight, just get ready to be blessed, to be impacted. We would not like to waste any time. I would have been calling our CEO and founder to be giving her welcome address now. But fortunately for us today, she's also a speaker. So it's like a dual role for her. So we will not do that. So I will again go back to Professor Akinlade to do a welcome on her behalf. Welcome everybody officially again, and then I'll go on to, yes, you step on that shoe, step on the shoe as CEO and founder. All right, over to you.
All right. I want to say welcome, firstly to our CEO. It's a privilege to have you do this. And I want to also say welcome to everybody joining from all over the world. Thank you so much for taking time to do this. Um, we have the honor of reading a biography for everybody to know more about her. I'm sure we all know, but some people need to know a little bit more about her. And to do that honors today, Dr. Michael, can you please read the biography? Thank you.
All right, thank you so much. I'll be reading the biography of our CEO and founder, who doubles as our speaker for today. Please, we'll be ready to listen through. I'll try as much as possible to be as fast, because we have a very robust bio to read. So, Ambassador Professor Dr. Adebusola Adenike Owokole, is a distinguished leader and multifaceted professional with over 17 years of experience in operating rooms and acute care settings. She is the founder and CEO of this amazing organization, the Operating Room Global, the largest network of all operating room professionals in one place, representing over 218,000 members across 100 plus nations. Under her visionary leadership, TORG has become a global platform for collaboration and knowledge exchange with 42 healthcare disciplines represented and over 20 chapters worldwide. I mean, it's an honor for me to be working with her in this organization. And in addition to her clinical expertise, Professor Adebusola is an accomplished Amazon author, an editor and writer, as well as a skilled computer programmer and a web developer. She is a multi-award-winning professional coach and mentor, empowering professionals globally to reach their full potential. Through TORG, Professor Adebusola Owokole training and consulting, she has mentored doctors and nurses seeking opportunities in Ireland, Malta, and New Zealand, having helped hundreds to relocate with their families in the past 6 years. So she's not just an icon at TORG, she's also impacting lives globally. Professor Adebusola's strategic partnership with healthcare organizations, academic institutions, and industry stakeholders has driven innovation, has improved patient outcome, and strengthened healthcare systems globally. Our work extends to capacity building and infrastructure development projects in underserved communities, ensuring sustainable healthcare solutions. She holds certifications from prestigious institutions, including Ondo State University of Medical Sciences, University of Benin Teaching Hospital, Babcock University, all in Nigeria, Harvard University, University of Côte d'Azur in France, Royal College of Surgeons in Ireland, and Anglia Ruskin University in Cambridge. Adebusola works at the UL Hospitals Group, and she's also a research fellow at the University of Limerick in Ireland. She's an associate director of Jason's Health Organization, an ambassador and chair of the Robotic Global Surgical Society, TROGSS, an ambassador's club, and a member of the TROGSS Fellowship Training Committee, who also serves as assessment and quality controller at TROGSS. She also serves at the international training program of TROGSS as well. Professor Adebusola continues to advance surgical education and professional development, leaving a lasting impact in the healthcare system worldwide. As a minister of God, she stands as a beacon of divine purpose and prophetic mandate, with unwavering dedication and an intimate work with the Holy Spirit. She embodies a dynamic leadership style that inspires and motivates others. Often referred to as the eagle's eye, and that's one of the names I call her. Her life is a testament to the fulfillment of numerous visions and prophecies that have shaped her ministry. She is the visionary of Divine Dynamics Ministry International. It is an honor to have Professor Adebusola with us today, as always, but today in another dimension, one whom will be receiving so much impact and value. So ladies and gentlemen, we have our CEO and founder, who again, like I said, doubles as a speaker for today. Please join me with a virtual round of applause as we make welcome our CEO and founder, who will take us on a ride this evening. Thank you so much, everyone. Professor Adebusola, please, you have the floor.
Thank you so much. I'm excited to be here. In fact, it's a privilege for me to be in your midst, and I'm excited to be doing this. Thank you for the invitation. Thank you for the honor. Thank you for that wonderful introduction. All the glory to God, as you have seen. And thank you to every leader and every member in TORG, to everyone who has made it possible, even since 10 years ago that we started in 2015 up until now. It's not something one person can do. I really want to say thank you to everyone. Thank you to the TORG community. Thank you to all our partners. Thank you to all the leaders, and most especially to the Global Education and Training Committee for organizing and facilitating this session. So thank you so much. It's a privilege to be in your midst. So today I'm going to be talking about clinical interview masterclass, which is centered on the STAR technique for surgical and perioperative roles. So basically, it's an approach that you use if you want to do if you are scheduled for surgical interviews or even perioperative interviews, it implies that this STAR technique, either you are a surgeon or an aspiring surgeon, you are an anesthesia provider, or even a perioperative nurse or a surgical technologist, whatever your discipline is. TORG is represented by 42 disciplines in the operating environment. Whatever your discipline is, you can use this approach, this technique that you are going to learn about today, and use that and excel in your interview. It can be used locally and internationally, but my focus is going to be more of international, so that even if you're aspiring to go out of your country, out of your comfort zones, and go to other countries and see what's obtainable, you can use this approach and excel in that interview. So that is what I'm going to be talking about. It's a masterclass because it should be interactive as much as possible. Hopefully we are not going to exceed 90 minutes in total anyway. So, but we'll see how we get on, and we'll try out as much as possible to be fast with everything we are going to do. So, the purpose of this session is basically to equip everyone with this structured approach for clinical interviews. Basically, it's to explore how STAR answers can help you to showcase your competencies in real life scenarios, in perioperative scenarios, in clinical scenarios. You are going to understand the STAR technique. What is that STAR technique about? Maybe some people know about it and you just want to know more, or you want to actually know its relevance. So this is the purpose of today. You're going to learn how to structure the impactful responses and interviews. I've been on interview panels, both local ones and international ones, even at hospital level. So I can really, really gain some perspective and saying how people actually respond to interviews and even use the STAR. Some don't even use it at all. But if you can pick on this information today and apply that to your own profession, definitely the sky is just going to be a beginning for you. It's no longer the limit. It's going to be a beginning for you. So the purpose of the session is to help you to practice tailoring answers for surgical and perioperative roles. Try to take notes as much as possible. This documentation is going to be shared and dropped in the chat box by the organizers. So you can pay attention at some point. I would expect people to respond, raise hand, and contribute to the questions as much as possible. And this session is also it's going to help you to improve your confidence and performance, especially in competency-based interviews. So why does this actually matter? This STAR technique matters because interviews nowadays increasingly focus on behavioral and value-based approaches. They want to see real examples from your experience. Panels are looking for reflective responses. They are not looking for memorized scripts, if you understand what I mean by that. So basically in surgical and perioperative roles, it's not just about the clinical skill that you have, but they want to see how you lead, how you communicate, how you respond, especially under pressure or in ethically challenging scenarios. They want to know how you think. They want to know how you prioritize things, how you work with others. If I'm on an interview panel and these are the things that I'm going to be expecting you to say, that is how you can stand out from others. Remember that at interviews, it's not just going to be only yourself. Even if your interview is scheduled for today, for example, that same day, if they give you 10 o'clock appointment, there is someone else at 10:30, there is another person at 11:30 or to 11 o'clock, and like that. Maybe the entire day is actually for interview day, but you want to make yourself distinct from the other candidates. You want to make yourself, you want to showcase that you've got competencies that they want. You're going to be an addition to their team. You're going to be, you're going to have initiative and more. So those are the things they're going to be looking for. So it helps. This STAR technique matters because it's going to help you to ensure that you actually present your experience clearly and confidently in a way that truly matters. So it matters because it showcases not just your ability to reflect, to lead, It's going to help you to show that you can act decisively in matters as well. So this STAR technique, it helps you to tell that story effectively. We're going to have so many examples in this session today so that everyone can learn as much as possible. So basically, about interview panels, if it's international panels, maybe expect 2 or 3 people, sometimes even 4 panelists to be on the panel. It could be just one person, especially maybe it's a private institution, or even if it's local levels, national levels. That is what I mean by local levels. It could be one person on that panel, but maybe max of 2. But if it's international interviews, for example, you want to go to Canada, you want to go to Ireland, you want to go to Australia and more, expect to see maybe 2 or 3 on the panel. Maybe max of 4. One person is going to be like an overall lead of the hospital. And then depending on your discipline, the second person is going to be your direct line manager that you are going to be working with. It could be maybe you are an anesthetist, for example. It could be the consultant or the head of department or something like that. If you are a perioperative nurse, it could be the manager that you are going to be working with. So that is usually the second person on the panel. But the third person, if the heart rate, it's an independent panelist that usually does not have anything to do, no affiliations with the hospital, no affiliations with the candidate whatsoever, but someone to make an independent decision that is not going to be biased or things like that. So expect that. So basically, because surgical positions, perioperative positions are very, very competitive, you are going to be having candidates with similar qualifications. Some even do better than, some have qualifications, but these panels want more than that. They want to differentiate you, know how you think, know how you can act. So you are going to be expecting maybe questions that relate to how you make clinical decisions under pressure. Team, how you communicate with the team, how you resolve conflict, how you demonstrate situation awareness and even adaptability and more. So those are the things basically to expect in your panel. So this STAR technique, it highlights how you actually think, how you act, how you reflect, especially under pressure. Now, what is that STAR technique that I've been talking about since? So basically, this STAR technique is a framework that helps you to structure your answers during clinical and competency-based interviews. It's an approach. So you just understand that this STAR is an acronym representing words, which S is the situation. You want to set the scene. That is, what is the context? Where were you when this thing happened? What was happening? Who and who was actually involved? Then the task is about which is the T aspect of the STAR. It's about what is the goal, what is the problem, what is your responsibility when the situation occurred. You understand? You want to mention your responsibility in that situation that you have just defined when you were setting the scene. Then A aspect of the STAR is action. The action means what you did exactly. What did you do exactly? And then the results. Obviously, you want to share an outcome. It doesn't always have to be positive outcomes. It could even be negative outcomes. But at the same time, even if the outcome of that scenario that you have just demonstrated is negative, you want to show that as much as possible, you learned something from that. There was a learning curve from that. You picked something, you demonstrated a result. It doesn't have to be always 100%, but they definitely want to see an outcome of what you did. After everything you have done, what happened to the patient? Is the patient still alive? Did the patient pass away? Did the patient develop any complications? Was the patient transferred into ICU? What was the outcome eventually? So this STAR technique, remember that when you are having interviews, basically the time is not on your side. You don't want to dwell too much on one thing either. You want to, as much as possible, be quick with what you want to say. So basically about the situation, maybe you are saying one-line statement on situation or two-line statement on situation. About the task, you are saying another one-line statement about the task, but the actions is where you actually dwell more and you say more things that you did. And then the result could be another one-line statement or even two-line statement on results. Definitely, that is what you want to do. So now about the situation, as I mentioned, it's about setting the scene. So you want to basically provide a brief background to give the interviewer an orientation of what was going on, when it happened, who was involved. We are going to see more examples in this during this session anyway, and then you can use that and adapt that to your practice and see how you can respond to questions. For example, if they are asking you, you are sitting on an interview panel, describe a time when you managed a patient, with a complex disease, or when you attended to an emergency case. Describe a time. That's the question. When you see questions like that, describe a time, tell me about a time, have you done this before, tell me what happened, and things like that. Know at the back of your mind that you are using that STAR approach to answer that question. It's a behavioral competency question that they want to see the scenario. They want to see a scenario. They want to see what your responsibility was during that scenario, how you acted exactly, and then the result. So this is just an example. During a weekend trauma call in the operating theater, I was part of a team managing a patient with polytrauma following a road traffic accident. An aspiring surgeon could use this scenario. A perioperative nurse could use this scenario. Surgical technology, anyone could use this scenario because this is actually a kind of multidisciplinary. And then T aspect is the task. One thing why some people fail because they fail interviews because when they are describing the task, they mention the responsibilities of everyone else, of the leaders, of the bosses on the team, you understand, but not about themselves. This task is about you. What were you actually tasked with? What was your responsibility during that scenario? What was the clinical operational goal that you as a person want to achieve? So this is for a circulating nurse. As the circulating nurse, I needed to ensure rapid preparation of equipment while keeping communication fluid between the surgical and anesthetic teams. That task is just a one-line statement. You don't really need to dwell on that. You can say, as the manager on duty, you can say, as the junior resident on duty, you can say, in my responsibility as the consultant on duty. That is just what that task is about. They want to see that you actually have a role to play in the scenario you have described. Now, on the action, basically, it's what did you do exactly? That's the core of your answer. So you focus on your actions, not on the things. What steps did you take? Why did you take them? Did you involve others? Did you lead other people? Did you assign responsibilities to others? Sometimes a scenario could actually be higher than your description, your scope as a professional. They want, on the panel, they want to see how you escalated that. Do you know the chain of reporting in your facility? Do you know who to escalate things to if there is an incident? That's what they want to see. Not necessarily you don't have to take all the blame, you don't have to take all the actions, but did you escalate this to the next person in line of management when it occurred? So this is just an example. I initiated a verbal periop checklist under pressure called for backup proactively, coordinated instrument preparation. So anyone can use that anyway. And then the result, what was the outcome? So what was the outcome? After all has been said and done, what happened? Did anything happen? If you are using a scenario based on research or anything, you can even mention that, oh, at the end of it all, when we did another audit, we reduced the infection prevention, the infection rates in department, maybe we reduced that by over 50%, something like that. It doesn't have to be with a value anyway. You can just summarize the surgery was completed without delay. with minimal blood loss. The consultant later commended my proactive communication. It reinforced the value of clear roles and assertiveness. Sometimes you might even develop a QIP, a quality improvement project from the action you took. You know, no employer would want to employ someone who can't lead, who can't communicate with teams they want to see, because these are the things that are going to be happening when you get the job eventually. So you have to be very, very careful on that. There has to be results. Now I'm going to talk about why STAR actually works for surgical and perioperative roles. So basically, the answers you are given on the STAR should not just reflect how you think on your feet. It should reflect how you respond to risk, how you support team-based care. So it's not like you are just ticking a box. It's not an exercise you have to take. It's not a story, but as much as possible, you want to demonstrate how you applied core values like communication, situational awareness, patient safety in real-world scenarios, and more. So this STAR helps to show your clinical reasoning. It helps to show that you can actually work under pressure. You can be accountable, you can demonstrate leadership, and not just that you have the qualifications, you are the owner of the certificate that you carry, and you can perform with that. So I'm going to talk about more about the STAR approach in clinical context. So basically, as much as possible, you will see questions related to clinical judgment, related to communication skills, resilience under pressure. They can ask you how you manage critical patients in the theater environment. They can ask you how you led a safety hurdle. They can ask you about handling of surgical equipment error. I'm just talking generally now because this is a multidisciplinary webinar. So then you can be asked how you actually resolved a conflict during a shift. So questions like this are actually STAR technique questions. So let's go into more explanation so that you can understand more. So this is an example. This is just an example. And the question you are being asked is, how would you manage a critical patient in theater? How would you manage a critical patient in theater? Remember, I mentioned that STAR is an acronym that you have at the back of your mind. You are not going to be saying that to the panelists that, oh, my situation is this and this, my task is this and this, my action is the, no. Those words are just going to be silent, but that is the approach that you are going to use to respond to each question when you get asked, when that question is only related to competency approaches anyway. So, for example, this question on managing a critical patient in the operating theater environment situation is, you can use a situation like, oh, 2 years ago, I was working in my second hospital, for example. I was in the operating theater environment. I witnessed a patient that was admitted or that was brought in for a procedure. You can name that procedure, who became hemodynamically unstable mid-procedure. That is your situation. So it's just like a story. When did this happen? Who was involved exactly? It's a one-line statement, max of two-line statement. I've seen interviews whereby candidates, they dwell more on the situation. They tell stories about everything. They give all the details of the vitals, which is not even needed, and they waste all there was no task. Eventually, the action was just one-line statement, and it was about what someone else did and no results. That is why people fail. So most of these panels, especially international panels, they have these templates on in front of them. They have the templates, these STAR templates, as part of the criteria. So while you are answering the questions, one person on the panel is asking you questions. The second person is noting your reactions, your facial expressions, and more. And the third person is actually making notes in that template that they have, the answer template that they have. So when you say something on the situation, you get the score on that situation. When you say something on task, you get the score. But if you omit any of this, then you have failed that question, regardless of what you do. So basically, when you are mentioning your situation, talk about a time when it happened. You can mention 2 years ago. You can even say last night I was on call and this patient was rushed in and so and so. Remember that the question is a critical patient and it depends on the role you are applying for. For example, if you're applying for a pediatric anesthesia role, the scenario you want to be using is going to be, you can say, a 7-year-old child was rushed in. You want to adapt that situation to the interview you are doing, to the role you have applied for as much as possible. So the task, my role was to ensure immediate resuscitation while maintaining sterile field and team coordination. What I did first was to ensure that I called for bloods, escalated to the consultant or the manager in the room. I managed communication between the scrub and anesthesia teams, and so on and so forth. Then as a result of my activities, of my actions, the patient was stabilized. We did a crisis debrief after the procedure, and we actually discovered that there was a huge gap in the reporting structure and in the transfusion protocol of the department. And we noted that that document needed to be updated, and that was exactly what we did. So when you are doing that, even the panelists would be like nodding their heads that this result was outstanding. It led to it led to the update of an expired protocol in the department. So remember that your situation is only a 1-line or 2-line statement max. Your task is only a 1-line statement. Make sure you personalize it, that my responsibility in this scenario was to ensure so and so. Then the actions, it can be 4 or 5 lines. Make sure you just briefly mention a group of things that you did and what happened eventually. What happened? Your answer, your results doesn't have to be patient oriented. It could be related to protocols in departments. It could be related to the update of documentation. Definitely, there has to be a result. There has to be a result. So just take note of that anyway. So then leading of a safety hurdle. This is like a perioperative one. You can use a situation that's where there was a high volume of surgical lists and you had new team members. It could be new staff members. Usually, if you work in surgery, you will notice that around July, they always swap teams. You have new residents, you have new registrars, you have new SHOs. Some people have zero knowledge of what is going on, and there is this high volume of lists that you want to cope with. Everyone is anxious. And how did you de-escalate the situation? Did you have a role to play? And that is where your task comes in. Your role was to ensure that everyone was aligned on their risk, on the contingencies as much as possible, and you led the briefing as part of your action. You highlighted key concerns. You discussed the allergy and risk of the patients, delegated responsibilities. And after all has been said and done, there was smooth list progression, no complications. The junior staff actually reported that they felt more confident as much as possible. So now this is another scenario, maybe for a surgical technologist or someone who would handle equipment, or they are asking you, how would you handle a surgical equipment error, or describe a time when you handled a surgical equipment error? So the situation that you can use when there was a missing tray and it was a key laparoscopic item and there was this case on could be a _coli or any other case that you can remember even, or you don't have to mention any case. You can mention the procedure or even the instrumentation that was missing then your task is to ensure that there was prevention of delay in the procedure and the patient was safe as much as possible. As part of your actions, you can mention how you liaise with CSSD, how you arranged rapid resterilization if there was no backup set, how you kept the surgeon and the scrubbed team updated all through. And the result of that was there was minimal delay. Even though there was a bit of delay, it was minimal to an extent. And then you shared the lessons at the departmental meeting and suggested that there should be an audit and processes like this should be in place just to prevent reoccurrence of situations like that. So basically, and then this is another example of resolution of conflict. you can be sitting on a panel and they ask you, how would you resolve a conflict during a shift? It could be on anything. You could be an anesthesiologist and there has to be conflict. You could be an aspiring surgeon. You have to have, even if it doesn't happen to you exactly, maybe it has happened to someone in your presence, another team member, but you make sure that you have a role. You played a role when that happened as much as possible. And whatever role you played helped to de-escalate the situation. You stepped in as a mediator. You acknowledged viewpoints of everyone. You can even mention that you called for a meeting. Eventually, there was resolution. I've been on a team and I think 3 surgeons, it was orthopedics, and 3 consultant surgeons, they were actually arguing on a case. This patient is asleep. When you have a patient that can't speak for themselves, then you need to know that there is a problem. What happened was the consultant that was meant to assist just came out from this research and was mentioning that according to that research, you needed to use Wiedin irrigation for the joint, total joint procedure, Wiedin irrigation. And then the second consultant was like, no, I just use sodium chloride irrigation planes, and it became a problem. This one wanted to use this as part of his research and more. And this one, even though it was approved, the patient wasn't aware of that. And the other person wanted just plain irrigation. And it was a revision case, and it became a problem, you understand? So sometimes when you get asked questions like this, maybe it was you witnessed it. You just witnessed that as a professional, and you wanted to come in as much as possible to help them to de-escalate this the tension. So, but if you have a conflict, maybe that happened between you and someone else, or you can also mention that. But in all you do, make sure there is a very good result that can convince them that what you actually did worked by all means. It worked by all means. No, now, so as part of the examples of this STAR approach, STAR questions, they can ask you about how can you communicate under pressure as much as possible. They want to know if you are clear, if you are calm, while conveying critical information, either it's during emergencies or when the emotions are very, very high. They want to see what you did exactly. And questions could relate to decision-making in emergencies, as we have seen, as much as possible. The key aspect that they are looking for in your responses would be how you prioritize actions. As much as, in an emergency, the patient would actually take priority over the protocol of the hospital. Patient would take priority over documentation in an emergency. Those are the things that they want to see, how you managed to risk, how you escalated the situation appropriately, considering that you've got limited time. And then another thing would be clinical leadership and delegation. You can ask questions like that. How you take initiative. You don't wait until someone says go. You just take that initiative as a person. You coordinate teams and ensure that the right tasks are actually handled by the right people. Sometimes they want to see how you consider the qualifications of others while delegating responsibilities. They can ask you about handling of difficult colleagues, difficult patients, and more. And especially make sure you prioritize what you did and how it's improved. That is the action and the results as much as possible. Prioritize that. If asked questions related to protocols, they want to see how you complied, how you ensured compliance with policies and protocols as much as possible. If dealing with difficult colleagues, it could be difficult patients. I've seen someone being asked a question, tell me about a time how you handled difficult patients. And what she said was that, she was just finished. She remembered a time that she had just finished a shift. She was almost on the way out of the department when she just saw this patient screaming at another nurse just across the hall, you understand? And she had to step in And while stepping in, she mentioned that her responsibility was to ensure that she de-escalated that issue as much as possible before it becomes a safety issue. And it wasn't her responsibility, even though she had already closed with another department. She witnessed that she had to step in. And as part of the actions, this is a safety issue. A patient has already been screaming at another patient. You don't know if this patient has a weapon or not. The panelists will be looking for how you maintained your own safety as well. You can stand at a distance and actually call out that patient and ask, oh, what was the situation? Can I help you in any way? I understand that you are tense and this and this and this and that. So you have to be careful as well while trying to respond if it's an emergency, if it's a difficult colleague, if it's a difficult patient, you could be stabbed. You understand? So you have to be careful. Make sure that you take the risk as much as possible. You minimize the risk as much as possible. So as part of the tips, think of this emergency as actually like star stories. They are star stories anyway, this competence says, but you are not just telling an ordinary story. You are telling a story that showcased your own competency as much as possible. It could be a minor case. It could be a major case. It could be a routine case. You want to show as much as possible leadership, sound clinical judgment. You now know that competencies are often tested through scenario-based questions. So when you encounter any scenario-based question, at the back of your mind, you are going to respond with the STAR technique, the STAR approach. So make sure you mention, even if the outcome wasn't really positive, make sure you mention what you learned from that or what you would have done differently another time and the outcome that actually resulted. So before I go to questions, really, I'm going to give a few more examples. So this is an example. Describe a time that you demonstrated leadership in a clinical setting. Again, this can be, this scenario, this example that I've given is for an anesthesia provider, either an anesthesiologist, or even you can be a junior anesthesia reg. You can use any scenario you want, but you want to show as much as possible that you demonstrated leadership. This situation, maybe you can say something like, oh, just last week I was on shift. It was an appendectomy patient, and just before they started, the patient was already on the table. The anesthetic machine alarmed. Something like that. Remember, it's a one-line statement, not a two-line statement. Then the task, your responsibility was to help to ensure that the patient is safe while you are actually maintaining the surgical workflow as well. So as part of your actions, you alerted your consultant or senior consultant, you paused the surgery, you mentioned to the team, and you coordinated troubleshooting with senior anesthetists or anesthesia providers on the team, and even the nursing staff as well. And you can mention everything that you did. And as part of your results, the issue was resolved within 5 minutes. Patient remained stable in terms of vital signs, and there was a debrief. The procedure went on as planned, no complications intraoperatively, and a debrief session was organized post-op. And then everything went well. So that is basically how you demonstrated leadership. You are using an equipment, you're not using patient directly, that it was during this case, the anesthetic machine alarmed, and that was exactly what you did. As part of the dues, make sure that you are specific. You go straight to the point. Don't dwell on the situation aspect of the STAR too much. Don't tell long stories. No one wants to hear that. There's no time for that, because you can be on the situation only and then the time is gone and they tell you to just round up, or we have another question to ask you. So one of the things that you want to do as much as possible is to be structured, to stick to that format, the STAR format, and you can make your role clear as much as possible, what you did and not just what the team did. Draw from a mix of scenarios as much as possible. If you are using this scenario for this question, when you get asked another question, make sure you go to something else. It can be related to research, it can be related to medication administration, it can be related to something else. Don't just do surgical procedures always. I mean, draw from a mix of scenarios as much as possible. And then I think I missed, okay. Yeah. So as part of the don't be vague, don't be overly technical. One of the biggest mistakes that people do is either they are too vague, they are long-winded. STAR is not a story. It's a strategic communication tool. Get to the point quickly, make your contribution shine, show that you owned the time. I mean, this session, be confident as much as possible, and make sure that your answer is always related to the role you have applied for. That is what interviewers are looking for. They are looking for reflection. They are looking for relevance. They are not looking for rambling. They are not looking for people that would waste their time. As much as possible, avoid passive phrases like I helped or we did. Show leadership and show initiative that you actually demonstrated. You owned that period and you delegated as much as possible. You took charge. That's the word I was looking for. You took charge of the situation as much as possible. Don't drift into unfocused storytelling. Stick to the point. Don't lose your interviewers in unnecessary backstory or detail. Stick to the point, go straight to the point, and don't waste much time. So provided you can tick all the boxes for the STAR, you are good to go for your next question as much as possible. Now, this is a scenario for surgeons and surgical trainees. I'm going to go to more scenarios as we go along. And then, so the question is about intraoperative bleeding during a laparoscopy. Well, it could be related to how you handled an emergency intraoperatively. It may not necessarily mention maybe there was a patient bleeding or it was a LAPCO procedure. It's on you to actually choose what you want to use as your scenario, but it could be something related to emergency. It could be something related to a never event in the operating environment or intraoperatively a procedure that was ongoing. How you helped. So as a surgical trainee, maybe as a surgeon, or you want to get this role, you are changing hospitals, or you want to travel to another country, or maybe you are applying for an observership or something, and you are sitting on this interview panel again, and they are asking you, how will you do this, or a fellowship program. So if you are using this example, intraoperative bleeding during laparoscopic cholecystectomy, you can say something like, oh, during a routine case for a 42-year-old female, patient had symptomatic gallstones and suddenly developed brisk bleeding from the gallbladder. That was shortly after dissection of the callus triangle. Remember that whatever example you are saying has to be related to the role that you are applying for and to your discipline as well. Don't use a surgeon's example while you are a perioperative nurse. You know what I mean? Then the task as the lead surgical registrar, my task was to control the bleeding, maintain a clear operative field, decide whether to continue laparoscopically or convert to open surgery, all while ensuring the safety of the patient and keeping the team coordinated. Sometimes if you are going for fellowship programs, they might ask you questions like this. So as much as possible, know a situation, know what your responsibility is, and as part of the actions, you immediately communicated with the anesthetic team to assess the patient's hemodynamic status, and you requested for a cross-match. Well, this should have been done. Depends on the policy of your facility anyway. Cross-matching and things like that, that should have been anticipated before the procedure. You can say you requested for that. You use suction to improve visibility and apply pressure with the gauze to localize the source and more and more. So mention the things that you did as much as possible. You can mention how you escalated as well and what actually transpired. Eventually, you converted to open procedure. You identified the bleeding branch of the cystic artery, and that was ligated. And what was the result eventually? The bleeding was successfully controlled. The patient recovered well postoperatively, no further complications. The case was later discussed at the departmental meeting. You can even say there was a case report on the case with permission of the patient, with consent from the patient, and it reinforced for you the importance. That's what you have learned. The importance of early recognition, team communication, and patient outcome. Remember this case, again, it's on LabCo, and you are mentioning that patient because the patient was a 42-year-old, was symptomatic with gallstones and more. It's common for maybe a bleed to occur from the cystic artery and the duct as well, the right hepatic artery. You have to make sure as much as possible that you take ownership of the session. Even in a routine case, doesn't have unexpected bleeding is a real possibility. And patients, for example, 42-year-old females, they have the profile that is typical for elective cholecystectomy. So it may not necessarily be emergency. As much as possible, the question that relates to intraoperative crisis management, maybe technical prioritization, a decision to convert to open surgery, you can always use a scenario like this. Now, this is another one, maybe for anesthetists, anesthesiologists, or anesthetic trainees. This, as much as possible, maybe you are being asked how you ensured a crisis was averted during a case, during a procedure, how you ensure that a crisis was averted, crisis management. They could ask you a question related to that, and you are looking for all the scenario to use. You could use this scenario of sudden desaturation during induction, for emergency laparotomy in a 68-year-old patient who had suspected perforated viscous. Patient rapidly desaturated with muscle relaxation. BVM was difficult. SATs dropped below 85%. So that is a very good scenario to use. If you are an anesthesia provider and they are asking you questions that relate to crisis management and more, you could use a cardiac arrest situation. You could use that. If the patient recovered, your patient didn't pass away after all, which is really, really good. You can use how you led the team as an ACLS provider. You can boldly say that at any interview and you will get the job, provided you can follow the approach, the STAR technique as much as possible. As the anesthetic registrar on call, your task was to immediately establish a patent airway, stabilize the patient, clearly direct the team on the pressure to avoid cardiac arrest as much as possible. Then remember I mentioned, dwell more on your actions and there has to be a result. What did you do to ensure that the SAT was improved? You instructed your assistant to perform a jaw thrust while you checked for bilateral chest rise, which is normal. Most times for GAs, you would see things like this. You suspected laryngospasm, difficult airway, you called for the difficult airway trolley. That should already be in the room and set up anyway, provided it's a GA case, and you attempted gentle positive pressure ventilation with a 2-person technique. You applied 100% oxygen with PEEP, your positive end expiratory pressure. And when there was still no improvement, sometimes there could have been improvement. You can even stop there. Maybe if you think you have extra time, you can say more of what you actually did. Depending on the case, depending on the procedure, administer a bolus of Prof and socks. And while there was enough muscle relaxation, ventilation was very, very easy. You were communicating this with the team continuously. Probably maybe at that stage, the surgeon was already pacing up and down and saying how everything is going to go well and things. And you updated them on the plan. As part of your action, as part of the result, the SATs improved, you wouldn't want to give actions that eventually you had to cancel the case. You don't do that. Even if that was the outcome when it happened physically, you wouldn't say that you had to cancel the case. Patient became unfit for procedure. No employer would hire anyone like that. I can tell you, they won't hire anyone like that because they would think when they give it the job eventually, any case after 4 o'clock in the evening, they all have to be cancelled automatically. Something needs to come up. You don't want to give that impression. As much as possible, give them the results, sat improved to 97%. You were able to intubate successfully on the next attempt. The surgery proceeded. There was no event. In the debrief afterward, communication was reviewed. Escalation protocol was reviewed. You were commended. Maybe you even mentioned you even got an award at your facility meeting or something. You want to say something nice that can improve your profile as much as possible. Remember, you're not the only one having the interview. There are other candidates, and there could be people better than you who will also demonstrate this. So that is what you want to showcase as much as possible. Sometimes patients that are 68 years or more, maybe elderly patients, they already have decreased physiological reserves. They may have comorbidities, maybe like COPD. They could even have cardiac disease and things like that. And as much as possible, even the fact that the patient that you are using even has this suspected perforated viscous already puts that patient at risk for peritonitis, sepsis, reduced oxygenation. Even that patient could have a risk of aspiration as well. So you want to show that as much as possible, you took ownership. You took ownership of that scenario when it happened. You de-escalated. The patient was revived back as much as possible. Now, this is an example maybe for perioperative nurses, for surgical technologies, it depends on what you are asked anyway. Maybe you witnessed, tell me about a time when you witnessed that the WHO timeout was skipped during a busy list. That is the question. Was skipped during a busy list. I can tell you that if you are attending international interviews, maybe you are traveling out of your country, especially if you are traveling to Europe, if you are traveling to other advanced countries, these competency-based questions, you can have 15 of them on the questions, 15 of them. So as much as possible, you want your antenna to be sharp. And you want to come, even if you haven't witnessed this, you need to you need to assume that it has happened to you, come up with that scenario as much as possible, showcase how you demonstrated leadership as much as possible. Now, this time, what happened, the timeout was skipped during a busy list. I know maybe most of us have witnessed these things. Sometimes when even timeouts, they may not even listen. You understand? Everything's just open, and things like that. So the situation you are given, you can mention, oh, it was my night shift. I was on this, I was that, or I was on call, or maybe it was my first year after I graduated for my first qualification or things like that. During a high turnover day in theater, it was multiple short cases under GA. Maybe if you want to go more, maybe in an orthopedic facility, short cases like this under GA would be something like scope, arthroscopic procedures. It's always very, very quick, and they don't want to waste time usually. And they may not necessarily want to even do this timeout, boy. It's your responsibility to ensure that it is done. So you attempted to proceed, the surgical team attempted to proceed with the incision before completing the WHO's surgical safety checklist timeout. Everyone was under pressure to keep on schedule. Sometimes if it's the last case of the day, people are always rushing like this, and you want to make sure that you do the right thing as much as possible. Remember, this is a scenario that I'm just giving for perioperative nurses and surgical technologists. Your task, make sure you have a role to play. You were the circulating nurse in that duty. If you are given a scenario whereby the timeout was skipped, you won't go and give the scenario from a scrub nurse's perspective, whose hands are actually tied to the equipment and the setup during the case. You want to show that you are the runner in the room as much as possible. It was your responsibility to ensure that that timeout was completed and that safety was not compromised, even though the time was under pressure. So what was the action? You stepped forward, you respectfully interrupted the team. That is what they want to see. They want to see someone that gets along well with team members, and as much as possible, you mentioned to the team, we haven't completed the timeout for patient safety. We just need to take a pause. And you reinitiated the checklist. You asked the surgeon and the statist, the team to confirm the patient ID, procedure site allergies, and anticipated risk and more, even though there was some initial resistance, because they may know already that this kind of things would not be accepted just like that. Some facilities, in fact, they now have this clickable boards. This clickable boards is like whiteboards in the operating room. So when they want to do the timeout, the circulating nurse goes to that board and presses something. So everyone hears this click audibly. And when you hear that clip, you automatically know that whatever you are doing, you need to pause and listen. You need to pause and listen. And that circulator won't proceed to the next thing until the next click. Understand what I mean? But in facilities where where there is nothing like that, definitely you have to say it respectfully and interrupt them as much as possible and say, please guys, we need to pause. We need to do a timeout. It's necessary for the patient and it's going to save you from a lot of litigations afterwards. So after the list, you initiated an informal debrief with the scrub nurse and anesthetic nurse or the team, the surgical team. You discussed how you could better maintain compliance under time pressure. So as part of the results, the team completed that checklist. Case was uneventful. Everyone was acknowledged. The consultant surgeon commended your efforts and more. That incident led to a team-wide reminder from theater management that you have to comply with the standards of this WHO safety checklist. So you were appreciated for what you did, for prioritizing the patient safety, and for upholding the care as much as possible. So that is what you want to show. Based on the STAR technique, you are demonstrating initiative, you are demonstrating calmness, you are demonstrating that you are competent as much as possible. You are showing clear communication. You are also reflecting that you have patient-centered thinking and you are committed to the highest standards of safety as much as possible. So basically, maybe for surgical technologists or even peri-op nurses as well, they could ask you questions, competence-based questions. Tell me about a time where you handled an equipment failure or where you ensured safety in the operating room environment. Remember that no employer would give you the role if you don't demonstrate this competency as much as possible. And everything you are doing, it's either they are ticking the boxes or they are recording the entire session in case when they release the results and you say, oh, why did they give me this? They will replay everything so that you can listen. It happens in advanced countries anyway. But for low and middle income countries, usually it's manual in paper. So you have to know what you are demonstrating as much as possible. And if you are a manager or a leader in your facility, you now know exactly what to look out for while you are having interviews with other applicants to your facility. So the situation that you can use during a total hip replacement, just before the femoral canal preparation, the reamer handle malfunctioned. This is an orthopedic case. There was no backup set immediately. Sometimes it could even be that the only equipment in the room that should be used, the major equipment that the surgeon is going to use was accidentally dropped by the scrub nurse. What happened then? The surgeon was ready to proceed and more. So you can use any scenario that deals with maybe handling equipment failure in terms of safety and more. As the scrub, your responsibility was to manage the situation calmly, communicate the issue quickly, ensure that the surgical team had the correct functioning instruments without compromising sterility. Now, as part of the actions, you can mention who you escalated that to, how you reassured the team to let them know that, oh, you want to quickly get this. It shouldn't take long as much as possible. You maintained the sterile field as well. Remember that during that procedure, there could be other team members. There could be junior students in the room. There could be medical students in the room. There could be people even that don't really know the boundaries, the confinement of the sterile area. So while doing that, you also want to ensure that you have an oversight of what is going on. You verified the backup instruments function. Maybe you're calling CSSD if you've got intercom. or you are running down to CSSD to see if you've got a backup, or you run this modular system and you've got like a central storage in your facility, in your theater environment that has where all the instruments are and things like that. I've seen a case whereby they called for backup sets. When that set was brought in, unfortunately, the inner wrap of the set was already perforated. They couldn't use that as well. And also, I've also seen a case whereby the only instrument left, they had to put that in Vidin. So they had to put that in a solution, I think, for like 15 minutes. And I've also seen a situation whereby the only implant, customized implant, was dropped during the case. And even there was this kidney transplant. Someone dropped that. I've watched that and I've seen that happen. And they had to pick it up as 5 minutes, 5 seconds rule. You wouldn't say anything like that at interviews, even if you have witnessed it before. But as much as possible, let them know how you try to get a backup, how you communicated with everyone, all the stakeholders involved, how you kept the team going, how you maintained the surgical workflow as much as possible. And as part of the results, the backup instrument maybe arrived within minutes, case proceeded without further delay, patient had no complications. After the procedure, everything was documented. The incident led to a check of all sets and new pre-op instrument inspection protocol. You can mention that, and you have to, some scenarios that you will mention, you might need to emphasize that you completed the incident reporting protocol for the facility after the procedure, especially if it's a near miss or something else could have happened, as much as possible. Now, I think I've been doing all the talking and talking and talking. I think I'm going to open the floor for people to respond to these questions. I think it's about 5 questions. So depending on you can respond from your discipline. It doesn't really matter. Maybe 2, we can call 2 people. You can raise hand. You can respond if you think you want to try out one of these questions and see how your response is exactly. So this is a question for open discussion. Describe a time when you had to make a critical decision under pressure in theater. What was at stake and how did you approach it? Remember your STAR technique. What was the situation? You only need 1 or 2 line statements max. Your task, you only need 1 line statement on task. Actions, maybe 3 to 4 lines on actions, and maybe 1 or 2 line statements on results. Do we have someone who wants to try this? You can raise hand. Does anyone want to try out this question? Maybe I can call a name. It's a masterclass and it should be interactive as much as possible. Let's see if anyone wants to try out this question. You can try from your experience, from your discipline. You may not necessarily use what we have used, the examples we have used before. You can come up with your own example. You can even use the same example. It doesn't really matter. All that matters is you have to get the approach. Can I call names, or let me see the chat box and see who and who.
There's nothing yet in the chat box, ma'am.
Oh, okay. Yeah. So thank you so much. So based on the question, does anyone from the audience, you can just raise a hand and comment. Do you know the answer to the question? Just use the STAR technique to answer the question. Let me call someone. Danjuma Aliyu, can you try this question from the audience? You can unmute your microphone. Let's see. Can you try? Let's see. Can you try that question? Or anyone else? Let me see who is connected. Emmanuel Adewoyin, can you try that question? I'm saying. Or Blessing. Blessing, do you want to try? Blessing, who good? Do you want to try that question? I really want to know if people are paying attention, and it's an open discussion anyway. Just feel free. Feel free. Okay, someone is saying she had a difficult situation. Jessica, you can unmute and answer the question. You can unmute and answer the question.
Hello, good evening, everyone.
Good evening.
Yeah, I had a difficult situation where we already had a list. We had four. My name is Jessica. I am an operation theater manager. So I had a difficult situation where we already had a list, a full list, 5 patients for that day. And then all of a sudden, the OB and gynae came in and said they had an emergency. So what I did, I had to plead with the surgeon that was supposed to start the first case for that procedure to take place. He was not happy, but with much plea, he said, okay, the procedure can go. And that was a difficult situation for me.
That's really good. Thanks for sharing your experience. I think from what I could pick from what you said, you mentioned the situation of what happened. The situation was difficult. It was a time where you were on duty, and then you mentioned briefly your task, which was as a manager of the operating theater environment, which is good. You mentioned the actions that you took, but unfortunately, I think there was no results in what you mentioned. So I would just recommend that even though you have a good, very, very good scenario, as much as possible, dwell more on the actions, not on the situation more, not on what happened more. The actions should be more, maybe 4 or 5 statements on the action. You can mention how you communicated with team, how you, not just the consultant now, what transpired exactly, what you did, maybe you organized another debrief session after the case, and how you monitored the patient intraoperatively and more. Then make sure that there is a statement of results. There has to be a statement of results. After everything you did, what was the outcome? What did you learn from that? What was the outcome? Because if one says the situation, if one says the task, a line on the action, if there is no result, there might be an issue. There might be an issue, and that question is considered not passed. If there is no outcome, it's considered not passed. So you have to be careful as much as possible. All you need to do is to get the approach, which you have done, mention the situation briefly, what happened, what shift it was, and your task. You can mention your position in that situation, and then dwell more on the actions, what you did, and let there be a result. Make sure you can, from the difficult situation, make sure you are tracing the results either back to the patient or back to the effect on the team, depending on the scenario you are presenting, or back to update of the protocol of the facility, or having to do a quality improvement project on that. So thank you so, so much for that wonderful contribution. Well done. I'm going to go to another question now. Okay, I could see someone raising hand. You can unmute. Emmanuel Adebusola, please. Thank you.
Okay, good evening. I learned you called me earlier, but I just want to contribute to the last speaker
Yes.
outcome. So far is a learning medium for us. I think one of the outcomes should be a clear policy should be written on giving priority to emergency. As a theater manager, you are not. Is a good action you took at least to settle the whole things to beg the surgeon. But the moment you have emergency, regardless of whatever elective case that is about to start, you have to give priority to emergency. I think one of those outcome and learning aspects should be part of it, contributing to that scenario. Thank you.
Thank you so much. That's a wonderful contribution. Thank you so much. So there should be priorities for emergencies, regardless. In that facility, it literally means that protocols need to be updated. There has to be a quality improvement project. Thank you so, so much, and more. I could see another hand raised. Dr. Nigat, you can unmute, please, and say something. Thank you.
Thank you. Maybe I can tell you a real story, and I found it really interesting. So, cases which we encountered under pressure in the oral theater. Can you hear me?
Yes, yes, please.
Yeah, as most of patients in middle-income countries are prone to preventable disease, a real scenario what I have encountered is a patient with multigravida present to obstetric ward with uterine rupture. Uterine rupture. She had term pregnancy. She came referred from the primary hospitals with diagnosis of uterine rupture because they have no care provider at the primary hospital level. So intraoperatively, what we encountered was the left internal and external iliac artery were completely transected with the rupture process. We were trying to secure hemostasis, but it was much avulsed and major distance was involved. So this was the scenario we have, and there was short of instruments such as the soft clamp, vascular clamp, routine obstetrics or cesarean delivery. Usually, thus the special instruments are not included in the obstetric or cesarean delivery. So this was the situation I had. So the task I should have completed, or the responsibility I had to do, was to ensure the patient had operated safely and recovered well. So to do this, the actions expected were to involve vascular surgeon. I don't have, that is a luxury for me, and I don't have a vascular surgeon, and we don't have vascular or soft clamp. And the actions we took were to clamp with other dusts, with mosquito arteries and other arteries, and to take deep breaths so that the team will have modest or to proceed well the procedure. So we do that. It's not appropriate to clamp the vessels with routine or ordinary arteries. So we do that, and we take a deep breath. We send cross match. Actually, as it was uterine rupture, it was readily available. And initially, what we noticed was the internal iliac artery was completely transected. So we repaired that first. So most laterally, down near to the deep circumflex iliac vein, near that branch, the external iliac artery was also avulsed, and the major distance has long distance involvement, and it's difficult to repair. So we hold with the clamp, and the option we had was to ligate the vessels proximally and distally, and to transfuse the patient much better. We transfused, we started massive transfusion protocol, and since major vessels were involved, we completed the uterine rupture. We did hysterectomy, and we proceed with the transfusion. Then the patient, after several minutes, after 45 minutes to 1 hour, become hemodynamically stable, and the patient were transferred to the recovery room. Actually, I want to tell you this was because this is, I didn't ever encountered external iliac and internal iliac artery avulsion during uterine rupture. It was amazing story for us we have. So finally, the patient, the result was good. She was transferred to the recovery room well, and later on she had sometimes for the first 5 days she had intermittent claudication at the thigh and lower limb. So later on, we followed her with a Doppler ultrasound. It was having flow, just not normal flow, biophasic flow. It was a uniphasic or monophasic flow. Later on, shows just that fine with no disability or other. So this was the real story. We managed like this in Ethiopia. Thank you.
Well done. That's a fantastic one. Well done, and thank you for sharing your experience. It's a very detailed one. I could see that from the surgeon's perspective. I'm aware you are a gynecological surgeon, which is really, really good. At the same time, you have explained the situation in details, your responsibility, your task, what that was meant to be, the actions you took in details, and the outstanding results. As much as possible now, you now get the whole picture of the STAR thing, how you should structure your response, which is really good. Another thing that you want to be careful about is on timing as much as possible. Remember that if this is it's half an hour interview and you are having about 15 questions to answer, which you don't really know because they are going to be asking you in turns. One asks you, and then the other person takes the second question in that order. As much as possible, you want to keep an eye on time. Make sure you are very, very, very brief and not to dwell more on a particular question so that you can cover more grounds as much as possible. But overall, it was a very, very brilliant scenario. And I must say, well done for that. I think because of the time, I should close this in 5 minutes and then maybe 1 or 2 questions or contributions from the team, and we can see what's in the chat box. The hosts they are going to drop the notes in the chat box for everyone to review. So maybe at your own time you can review the questions. If you have any questions or anything, or maybe you can even send your scenarios to me or to any of our leaders, and they can go through for you and see if you actually got it right. So this is another question on team leadership or delegation. They can ask you, share a time when you led a team during a challenging perioperative case or shift. I believe everyone now knows exactly what to answer in this kind of scenario. You can give question of what has happened, the procedure. It could be that you witnessed as well the situation. Make sure you mention what your task was, the actions you took, especially leadership behaviors that you demonstrated when that happened, and how you communicated and delegated tasks. And the result has to be the impact that your leadership had on the team. And what was the result? What did you learn eventually? And then you can be asked the question, describe a situation where clear communication prevented or resolved the clinical crisis. We've seen examples of this, so I'm not even going to go back into that. But as much as possible, sometimes this behavioral question might kind of be, they might look interwoven or maybe related. When you give, I first mentioned this, be diverse in your perspective, in your examples. Use diverse scenarios. If they ask you something that relates to maybe what you have said previously, make sure that you are using a different scenario entirely. You can even say, oh, it was COVID session, we were very short-staffed and this and that, and you had to allocate staff based on the skill mix in the theater environment, or maybe your team, you are a manager in your department and things like that. You can mention a period of time where that thing happened, but make sure that you don't dwell too much on situation and task as much as you should need to do, but the actions and the results will take priority over everything else. They can ask you, have you ever had to mentor a junior colleague or a student in a high-stakes situation? Have you ever had to mention, you can mention the time you were you had to mentor like maybe a junior staff member as a surgeon, maybe a junior resident or a reg under you, or it could be an SHO, it could be someone stepping into the theater environment for the first time and doesn't even know how to scrub and things like that. You can use that kind of scenario and make sure that when you are mentioning your actions, you can talk more about emphasizing the safety protocols, about your role in teaching methods you used, and especially the results. I've seen a situation whereby I worked with someone. Well, it wasn't me directly anyway, but I witnessed it. This lady when she scrubs with this particular surgeon, she knows the stuff, but because she's from a different country, right? She doesn't understand the names of those instruments in English language. She only understands them in her own language. She was Spanish, and then and then it became a problem. And sometimes people think, oh, is she really deaf? Is she really this? She knows the stuff, right? But when they call out the name in English, it's a problem. So everyone had to join hands to actually help this lady to succeed. We were looking online, recommending lectures, recommending YouTube videos, recommending instrumentation things so that she could actually take her time to know them after work each day before scrubbing for a procedure. So she became better all overall. So you can use something like that. You can use how you mentor students. You can use how you mentored medical students. You can use how you just they want to see teaching roles, mentoring roles, and as much as possible. Now, there are times when this STAR may not necessarily be needed. You don't use STAR approach for all questions at the interview. You know, for example, they can ask you, what are the contraindications to laparoscopic cholecystectomy? This is a technical question. It's a knowledge-based question. It's an anatomy question. You don't need to start from a scenario. You don't need to start from what's your task, because there is not going to be any scenario. They're just asking you straightforward, what is the contraindication to laparoscopic cholecystectomy? You can just mention that in points. Describe the steps of spinal anesthesia. Describe the steps of spinal anesthesia. Those are like technical question. You don't need STAR approach to answer them. They just want you to be direct. They want you to answer concisely and show your clinical knowledge. Remember that STAR is not too long-winded. It's unnecessary for fact-based answers. Then you don't need the STAR technique when the question is hypothetical, or maybe it's non-experience based. When it's non-experience based, sometimes there has to be a way they ask you, maybe tell me about a time when or describe a time when this happened to you, or this and that. There are some that just need logics and ethical reasoning. Make sure you judge the situation and see the pattern that they're actually using to ask you these questions before you start your STAR approach. Then for these hypothetical questions, sometimes you can actually use your STAR to answer them, but make sure that you focus more on your actions and results as much as possible. So you can adapt STAR. If you have a relevant past experience, it's not really essential. But if the question is asking you, what would you do? You understand? Doesn't really mean that you had the experience in the past. They just want to see if this thing happens to you, either you have the experience or not, what are you going to do? Now, motivation questions or personality questions, you don't need the STAR technique to answer that. If they ask you, oh, why do you want to work with us? What are your strengths? What are your weaknesses? Tell us about your career goals. In fact, most times when you sit on an interview panel, either nationally and internationally, what they will tell you is they cannot tell you, walk me through your CV. You wouldn't expect yourself to be using STAR technique to answer that. You understand? You wouldn't expect that, like, walk me through your CV. That's basically the professional summary. You're not going to say, my name is so and so. They already know your name. They have a copy of your CV. They have your documentation. They are looking at you in front of them. You are going straight to your professional summary of your your education, your highest education. You are emphasizing that, and your most recent job, basically. So questions like on motivation, on personality, they are just reflective, personal. You don't need to use the STAR technique. Like, tell us a bit about yourself. What do you like to do outside of work? They want to see your hobby. Maybe if you are stressed at work, sometimes they want to really see if you have a way of unwinding after a stressful day. Maybe you can say something like, maybe you take a walk, you listen to music. Someone like me, I listen to music a lot, listen to music and things. You can say you take a shower and things, but make sure that you are not saying, oh, you like to travel. Like actually things like that, you understand? They want to see someone that is committed to their work at the same time that has work-life balance. So this is natural. It's conversational. Sometimes they just want to decrease your tension as much as possible. Now, when you see questions that start with something like, tell me about a time when that is definitely your STAR behavioral competency question. Describe a situation where you did this. That is about your STAR. You need to use your STAR. Give an example of this, give an example of that. You need your STAR. Those questions like that are actually competency-based. They are behavioral questions, and they're actually ideal for stars. So I think this is the second to the last slide. So basically, interviewers will look for your clarity of your thoughts. They want to look at how you can reflect. They want to look at how professional you can be in even the very, very challenging, most challenging situation. And those are the things they will be looking for. Now you are accountable to yourself, to your patients, to the department, and more. You can practice, you can look up a range of questions like that online. You can even have like a bank of these STAR examples that if they ask you a question related to this, you can have them at your, you can have them draft them, have them in a journal and practice them before you actually face a real life interview. And make sure that you always align your responses as much as possible with the job specification that you have applied for. So thank you so much, everyone. I believe it's been a long journey. I want to say thank you to everyone for listening. So I'll welcome questions and any contributions, including from the comments, from the chat box as well. Thank you. Over to you, our organizers. Thank you.
Thank you so much, Professor Owokole. Thank you so much. This was refreshing. This was great. And I must tell you, I have a major interview coming up, and I'm like, oh, so this is great. Thank you so much. I want to say to everyone, please, I posted something in the chat box. I want you all to go look for it. It's just the post-session evaluation. And if you need certification for this session, you also need to fill out this so you can get your certification. I am looking through the chat box now to see if anyone has any other question to ask our speaker today. If we do, you can put it in the chat box 1 minute. You can just raise up your hand so that we can talk about it in 1 minute. It's already 12:30 and we don't want to take too much of our time today. But I don't see anyone coming up with any questions still. If we don't, there was some question that was asked and the speaker already spoke about it, about the slides that they want to go over it later. If we don't still have any question, I'm just going to give it up to Dr. Michael so he can do the closing notes and we all can go. Thank you so much once again for joining.
All right. Thank you so much, everyone, for joining in on this call. Thank you again, our CEO and founder. Thank you for that robust conversation we just had. I think I promised everyone that you were going to get value for your time, and you can, of course, you can come and attest to the fact that that was what you actually got over the past 1 hour, 30 minutes we've been on this call. Since we do not have any other question, I like to say a big thank you to everyone who has joined in, and to say that we have these calls every month. So you may want to join the TORG. You can check us out on our website, and then you can join the TROGS community. We are open to every profession within the medical field, and like we said, we represent a myriad of medical professionals, and we are like the largest place where you can find all medical professionals in one place. So you want to join us. We have different programs coming up. In August, we have a major event coming up. We'll be celebrating our 10th anniversary right in the city of Kigali in Rwanda. So you can check, like I said, you can check our website for all of these details. Our CEO and founder just dropped the website link, so you want to click on that. And just to reiterate what Professor 𝐵𝑑𝑢𝑐𝐞𝐫 had said, you can go ahead to fill the Masterclass webinar post section evaluation and certification form. It is still in the chat box, so do well to click or copy before we end this call. And again, for those who may want to register to join the TORG, our website is on the chat box. You can copy that as well to join. Our CEO and founder is on almost all social media platforms, or you can simply connect with her on LinkedIn, which I believe is one of the most professional of all the social platforms or professional platforms, as it were. So you may want to connect with her, reach out to her. If you have further questions for her, she's always open to listen and always open to lend a helping hand. So you could go ahead to copy her name. Her name is what she has on all her social media platforms. You can also follow the TORG on all social platforms, on Facebook, on Instagram, on TikTok. Yeah, I'm sure we're on TikTok. On Facebook, on Instagram, on Twitter, on LinkedIn. You want to follow the TORG on all social media platforms, also so that you can get the first-hand information and also to get insights as to what we are about and what our goals are. So yeah, thank you so much everyone for joining in. It's been an amazing time with us. See us next month in July. Out for all our announcements on our communities and on our social platforms. And until then, it has been an amazing time hosting this with Professor 𝐺𝐻𝐿𝐴DE. And we see you next time. It's a bye-bye from here. Thank you so much.
Thank you, everyone. Bye. Thank you so much. Have a nice day. Thank you. Yeah.